Good evening, Philippines and the world. Today is Tuesday, March 31, 2020. Join us for the next 45 minutes as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and live via streaming worldwide through UNTV News and Rescue Facebook account and UNTVweb.com. I am Victor Posare sitting in for William Theo.
And here are the headlines.
The number of coronavirus disease 2019 cases in the Philippines soars to 2,084 as Luzon enters the third week of enhanced community quarantine. The Department of Public Works and Highways recommends to convert some government facilities, arenas, and coliseums into alternative quarantine facilities as hospitals become overwhelmed with a rising number of COVID-19 cases. The national government has allotted a total of 200 billion peso worth of aid for low-income households, farmers, and fisher folk amid the COVID-19 pandemic. The COVID-19 Interagency Task Force recommends to President Rodrigo Duterte the importation of 300,000 metric tons of rice as contingency. The World Health Organization warns that the coronavirus epidemic in Asia is far from over. And COVID-19 survivors share their stories of hope amid different battles.
Several other laboratories in the country, aside from that in Research Institute for Tropical Medicine, or RITM, have been authorized to test samples for COVID-19 detection. With this, the number of confirmed cases in the country continues to increase. Aiko Miguel has more updates.
538 new cases of COVID-19 positives were recorded today in the country. This brings the country's tally of confirmed cases to 2,084. According to the Health Department, this is the highest daily record in the Philippines. 10 more death cases were also recorded. The country has lost a total of 88 patients to COVID-19 as of today. On the other hand, 7 additional cases have recovered. Because of the continuous surge of COVID-19 cases in the Philippines, the management of University of the Philippines Philippine General Hospital, or UPPGH, worries their supply of personal protective equipment, or PPEs, won't be enough for their healthcare workers. UPPGH has a 130 hospital bed capacity for COVID-19 cases. In an interview with Dr. Jonas Del Rosario, the spokesperson of UPPGH in the program Get It Straight with Daniel Razon, he said UPPGH is equipped with enough ventilators once COVID-19 cases shoot up further.
Is what we need. Sa ngayon po, meron kaming 60 ventilators, no, na ready. Just in case po na medyo malas-malasin tayo, 50% ng 130 ay tamaan ng matinding sakit. Ready po tayo sa ventilators.
But UPPGH is concerned over an ample PPE supply for healthcare workers once the country's curve of the disease reaches its peak.
For now, ang aming pong consumption, ang aming estimate is kung yung 130 beds po na yan ay fully occupied, you're talking about 1,000 PPEs a day, no? Pag ganyan po, tinitingnan po namin yung aming stock, baka po mga 10 to 14 days lang sa ngayon ang aming kayang punuan.
For now, UPPGH is outsourcing and accepting PPE donations. Meanwhile, Dr. Takeshi Kasai, the Western Pacific Region Director of WHO, said in a virtual press briefing this morning that countries in the region, which include the Philippines, should gear up and prepare for the surge of COVID-19 cases.
We need to also prepare for a large-scale community outbreak. And also, we may have to also consider, because we cannot continue this effort as a forever. So we have to find a approach, a balanced approach that we can also make our societies run.
Dr. Kasai also said that lockdown of countries like what is implemented in the Philippines is a good move to contain the COVID-19 virus and prevent its spread. But he emphasized the government should sustain its efforts for contact tracing, early detection of infected individuals, and the implementation of quarantine on those considered as close contacts of COVID-19 positives.
Government has to ensure the basic lifelines will maintain. So if you don't have those kind of structures, it's very difficult to make those measures. And lockdown, to be effective, we have to also continue find the case, isolate and treat early, and also trace and quarantine those contact. And lockdown is a bundle of public health measures.
Aiko Miguel, UNTV News and Rescue, Quezon City. We serve the people, we give glory to God.
The Department of Public Works and Highways recommends to repurpose 4 large buildings in Metro Manila amid the COVID-19 crisis. This is while different local government units have designated quarantine facilities in their towns and cities to isolate COVID-19 patients. Joan Nano tells us why.
Several hospitals in the country are now overwhelmed as the number of confirmed COVID-19 cases continue to shoot up. Even the numbers of patients under investigation or PUI and persons under monitoring or PUM are swelling every day. Different local government units have designated quarantine facilities in their towns and cities to isolate COVID-19 patients. The Department of Public Works and Highways or DPWH for its part recommends the conversion of 4 huge buildings in Metro Manila to be used as COVID-19 facilities. These are the Philippine International Convention Center or PICC and the World Trade Center both in Pasay City, the Philippine Institute of Sports Multipurpose Arena or Phil Sports Arena in Pasig City, and Rizal Memorial Coliseum in Manila City. According to the DPWH, the 4 structures can accommodate around 2,905 possible patients. The Interagency Task Force for the Management of Emerging Infectious Diseases has tasked the DPWH to begin the preparation of these establishments.
The Department of Public Works and Highways, or DPWH, in cooperation with private entities, shall complete all the works necessary to convert the Philippine International Convention Center, or PICC, the World Trade Center, the Rizal Memorial Sports Complex, and such other facilities as may be necessary into fully functional quarantine facilities.
In accordance with the Department of Health's protocol, DPWH Secretary Mark Villar says confirmed COVID-19 patients may be placed in shared spaces or rooms, while PUI shall be separated in a different space, tent, or room provided with individual enclosed spaces and separate entrances. Distance between patient beds should be maintained at least 3 feet apart to avoid further infection. Facilities will be divided into 3 zones: the contaminated, buffer, and sterile zones. The contaminated zone will serve as the area where patients are admitted. The buffer zone will serve as an area for doffing personal protective equipment or PPE, hand hygiene, and other decontamination protocols, while the sterile zone will serve as a holding area and entrance for healthcare workers and area for PPE donning. The DPWH also reports that 19 DPWH evacuation centers across the country are now being used as health facilities, while 10 serve as emergency operations centers. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine government will soon roll out the largest social protection program in the country's history. But President Rodrigo Duterte issues a stern warning to government agencies tasked to implement the program. Rosalie Cos details why.
President Rodrigo Duterte has given his marching orders to particular government agencies who will implement the social amelioration program that will benefit the sectors most affected by the enhanced community quarantine. Around 200 billion pesos worth of assistance will be distributed under the largest and widest social protection program in Philippine history, according to the president.
If I discover some embezzlements, some hoarding there, at dinadivert yung pagkain sa mga tao na dapat hindi sa kanila, you better think. I am not a cruel man. Pero kung may report ang pulis. I will order your detention hanggang matapos itong COVID-19. Sabi ko, wag ngayon. Wag na wag kayong mandaya, mangurakot, at taguin yung mga pagkain at yung iba hindi bigyan.
President Duterte also assures frontliners of the government's effort to provide the necessary medical supplies and equipment for them to save more lives.
About 1 million medical protective items are being acquired right now, with the government and the private sector working together to purchase or produce the necessary quantities.
In his public address last night, he also thanked the nations who extend helping hands to the Philippines, such as China and Singapore. The president also expressed gratitude to companies, business leaders, and organizations who show charity amid the health emergency. He also has this appeal.
Let it be said that in the hour of our country's greatest need, we all look out for and help each other. Buksan natin ang ating puso sa nangangailangan. I also appeal to the private sector to contribute in any way you can in dealing with this national emergency. We implore employers to do their part in protecting the welfare of the millions of Filipino households that belong to the formal sector and depend on their employers for continuous livelihood.
Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
The U.S. death toll from the coronavirus pandemic climbed past 3,000 on Monday, the deadliest day yet in the country's mounting crisis. While New York cheered the arrival of a gleaming 1,000-bed U.S. Navy hospital ship as a sign of hope in the city's desperate fight against the coronavirus disease 2019. Beverly Saison reports.
In a grim new milestones marking the spread of the coronavirus, total deaths across the United States hit 3,017, including at least 540 on Monday, and the reported cases climbed to more than 163,000. People in New York and New Jersey lined both sides of the Hudson River to cheer the U.S. Navy ship Comfort, a converted oil tanker painted with white giant red crosses, as it sailed past the Statue of Liberty, accompanied by support ships and helicopters. The Comfort will treat non-coronavirus patients, including those who require surgery and critical care, in an effort to free up other resources to fight the virus, the Navy said.
As the USNS Comfort entered New York Harbor, coming here to save the lives of New Yorkers in our hour of need. We've all been through a lot these last few weeks, and we needed this boost.
Hospitals in the New York City area have been overrun with patients suffering from COVID-19, the respiratory illness caused by the virus. Officials have appealed for volunteer healthcare workers.
We can't take care of you if we can't take care of ourselves. So I think a lot of us have accepted the fact that, we're probably going to get this. It's just, we want to survive, we're all being exposed to it at some point.
The United States has the most confirmed cases in the world, a number that is likely to soar when tests for the coronavirus become more widespread. President Donald Trump told a White House briefing that more than 1 million Americans had been tested for coronavirus, less than 3% of the population. While the United States has ramped up testing after a series of setbacks, it still lags countries like Italy and South Korea on a per capita basis.
Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line. This 30 days, so important because we have to get back.
In California, another hard-hit state, Governor Gavin Newsom said the number of COVID-19 hospitalizations had nearly doubled over the past 4 days, and the number of ICU patients had tripled. Officials there also appealed for medical volunteers. Beverly Saison, UNTV News and Rescue, USA. We serve the people. We give glory to God.
The World Health Organization, or WHO, has warned that while attention has shifted to epicenters in Western Europe and North America, COVID-19 epidemics are far from over in Asia and the Pacific. Kath Dumaraos will tell us why.
The coronavirus epidemic is far from over in the Asia-Pacific region, and current measures to curb the spread of the virus are buying time for countries to prepare for large-scale community transmissions. Takeshi Kasai, Regional Director for the Western Pacific at the World Health Organization, said even with all the measures, the risk of transmission in the region will not go away as long as the pandemic continues. The new coronavirus first surfaced in central China in late 2019. Infections have now exceeded 770,000 cases worldwide, with the United States, Italy, and Spain overtaking mainland China in confirmed cases.
We still don't know how long this COVID-19 fight will continue. There are people around the world, 24 hours, 7 days, they're doing their best to fight with this COVID-19. But it's unlikely that this virus will disappear next week or even next month.
Countries with limited resources are a priority, such as Pacific Island nations, he said, as they have to ship samples to other countries for diagnosis, and transportation restrictions are making that more difficult. Kasai warned that for countries that are seeing a tapering off of cases, they should not let down their guard or the virus may come surging back.
Even with all of these measures, the risk will not go away as long as the pandemic continues. Rather, these measures can buy us valuable time to prepare for large-scale community transmission.
WHO Technical Advisor Matthew Griffiths said the WHO does not expect any country to be safe, as the coronavirus will eventually get everywhere. Griffiths said the focus of the epidemic is now on Europe, but that will likely shift to other regions. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
Now let's get the latest tally of the coronavirus cases around the world. The COVID-19 pandemic has now reached a total of 788,522 confirmed cases in 178 countries. The fast-spreading disease has also claimed 37,878 lives, with 166,768 recovered patients across the world. The United States of America now has the most confirmed cases in the world, with a total of 164,610 cases and 3,170 deaths. Italy, meanwhile, still has the most coronavirus-related deaths globally, with 11,591 fatalities and 101,739 confirmed cases. As of March 31, 2020, Spain has now overtaken China on the number of confirmed cases, with 87,956 confirmed cases, followed by China with 82,240, Germany 67,051, and France 45,170. Meanwhile, the Philippines records its biggest single-day increase in COVID-19 cases, with 538 new cases, bringing the total of confirmed cases to 2,084 persons. 10 new deaths were also recorded today, bringing the death toll in the country to 88. Up to date, there are now a total of 49 recovered patients in the Philippines. 18 million families in the informal sector will soon receive assistance, but the government will have to check and recheck the list of beneficiaries before the financial aid reaches the hands of beneficiary households. Rosalie Cos reports the reason why.
The
Department of Social Welfare and Development, or DSWD, will consolidate the list of all the beneficiaries of the Social Amelioration Program through various government agencies such as the Department of Labor and Employment, Department of Agriculture, and others. While doing that, it will continue the distribution of relief goods in the coming days. The DSWD already has an existing list of beneficiaries, but it will also gather lists that will come from the local government units and barangay captains for cross-checking. After the consolidation, verification, and finalization of the list, the financial assistance will be distributed.
So food assistance po muna ang ipamamahagi ng ating national government, and then to follow na po yung financial assistance gamit yung listahan combined na po ng national government list at ng LGUs para to avoid any duplication.
As for the formal workers who have been forced to stop working amid EZQ, the Department of Labor and Employment will base its financial assistance on the payroll to be submitted by the employers.
Yung mga employer, please, at the soonest possible time, ipadala na yung payroll ninyo. At doon namin makukuha yung listahan ng mga manggagawa ninyo na hindi makapasok at sila ang bibigyan namin ng cash assistance of 5,000.
The informal or mostly the self-employed workers will be provided jobs for 10 days with minimum wage per day. The beneficiaries of the Social Amelioration Program include senior citizens, persons with disability, pregnant and lactating mothers, solo parent, indigent indigenous people, the homeless, transportation vehicle drivers, and the informal economy workers. The DSWD, together with various government agencies, local governments, barangay captains, policemen, and soldiers, will help in the distribution of the necessary assistance. Based on the Bayanihan to Heal as One law, financial aid amounting from 5,000 to 8,000 pesos will be given to 18 million families in the informal sector. Meanwhile, Secretary Nograles has revealed that the IATF Technical Working Group, chaired by the Department of Health, will determine the parameters for deciding on the eventual total, partial lifting, possible extension of duration, or expansion to other areas of the Enhanced Community Quarantine or EZQ all over Luzon. But for now, what is clear, the report of alleged 60-day extension of EZQ is fake news.
Importante po ito at ulit-ulitin po namin, hindi po totoo ang kumakalat na balita, fake news po, na i-extend ang Enhanced Community Quarantine ng 60 days. Sa usapin na ito, science is in charge.
Rosa Licoz, UNTV, News and Rescue. We serve the people, we give glory to God.
Interior Secretary Eduardo Anyo has tested positive for COVID-19. The official said he got tested on March 27. And today, March 31, he received his test result from the Research Institute for Tropical Medicine, or RITM. SILG Anyo calls the attention of all persons he had close contact with to go on self-quarantine and observe any symptoms in accordance with the Health Department's guidelines. Meanwhile, former Senator Ferdinand Bongbong Marcos Jr. also tests positive for the disease, as confirmed by his spokesperson, Attorney Victor Rodriguez. According to Attorney Rodriguez, the health condition of the former public official is improving by the day. Former Senator Marcos has previously traveled to Europe. The Interagency Task Force on COVID-19 recommends to President Rodrigo Duterte to import 300,000 metric tons of rice. This is while the country is under a state of calamity due to the threat of COVID-19. Dante Almento tells us why.
The government wants to maintain a stable and sufficient rice supply in the country in the coming days. The Interagency Task Force for the Management of Emerging Infectious Diseases has recommended to President Rodrigo Duterte to import a total of 300,000 metric tons of rice while the country is under a state of calamity due to the threat of COVID-19.
Nirerekomenda po ng IATF sa Office of the President ang proposal ng DA na mag-import ng 300,000 metric tons ng bigas para matiyak na hindi po tayo maubusan ng supply.
The recommendation is based on the Department of Agriculture's proposal to ensure a stable rice supply. The importation of rice will be done through a government-to-government agreement. The government also will ask trading partners in the ASEAN region not to implement restrictions on the entry of food supply in the Philippines. The government also stresses the movement of cargoes and agriculture and food products remains unhampered.
Inuulit po ng IATF na dapat hayaan ang tuloy-tuloy na daloy ng mga kargamento at pagpasok ng mga manggagawa sa sektor ng agriculture at food production.
Dantiamento, UNTV, News and Rescue, Quezon City. We serve the people, we give glory to God.
Almost 50,000 curfew violators have either been sent home or sent to jail. The Department of the Interior and local government, meanwhile, orders the PNP to continue to arrest those who do not follow the curfew hours set by the government. Leia Ilagan tells us why.
The Philippine National Police believes that the number of arrested curfew violators will further increase. Joint Task Force Coronavirus Shield Commander, Police Lieutenant General Guillermo Eliazar says that from March 17 to 29, they accosted 49,000 curfew violators nationwide. More than 14,000 are from Metro Manila. Of those violators, more than 35,000 were just warned and sent home, while over 14,000 were sent to jail.
Ang mga arrested ay nahulog kung papawalan sila ng kaso. Depende kasi yan sa mga ordinansa ng iba't ibang mga lokalidad natin. Pero kung iba na talagang multa lang ang nasa provision. Kung hindi makapagmulta, ikukulong sila.
Eliazar adds the number of arrested persons will further climb if people continue to disobey the government's directives for the enhanced community quarantine period. Interior Secretary Eduardo Año also orders the PNP to continue to arrest curfew violators. According to SILG Año, the PNP can file a case against them or place them behind bars to discourage from violations. Leia Ilagan, UNTV News and Rescue. We serve the people. We give glory to God.
The Bayanihan to Heal as One Act was passed by Congress in a special session last week. It authorizes the President to exercise powers necessary to address the COVID-19 crisis in the country. But did you know that years before, a proposed measure seeking to strengthen the country's response against pandemic was filed in Congress? Arlene Delgado has the details.
In 2013, Senate Bill number 1573, or the Pandemic and All Hazards Preparedness Act, was filed by the late Senator Miriam Defensor Santiago in the 16th Congress when the Middle East Respiratory Syndrome or MERS outbreak struck. But the bill remained pending at the committee level. The measure seeks to strengthen national response and preparedness for public health emergencies, including those caused by natural disasters, recent outbreaks and pandemics, bioterrorism, mass casualties, and chemical emergencies. Under the bill, the Secretary of Health will lead the creation of a national health strategy to address public health emergencies. This strategy shall include increasing the preparedness and response capabilities, optimizing the surge capacity of medical facilities such as hospitals and other healthcare facilities, taking into account the unique needs of individuals with disabilities, advancing countermeasures to diagnose or treat harm from any biological or other agents, and evaluating preparedness and response through drills and exercise. The Secretary of Health will control the task force to conduct research necessary for the creation of strategy, which includes representatives from the National Disaster Risk Reduction and Management Council or NDRRMC, the Department of the Interior and Local Government, the National Security Advisor, and the Philippine National Red Cross. The bill mandates the task force to monitor emerging concerns relating to public health preparedness and response for at-risk individuals, identify and minimize gaps in medical and public health response activities, update best practices before, during, and following public health emergencies, and ensure the effective delivery of public health information. The Secretary of Health shall also establish a medical reserve corps composed of volunteer health professionals who will be called into duty if needed during public health emergencies. The pandemic bill also authorizes to appropriate emergency funds every fiscal year. There were other proposals concerning the country's response during public health emergencies in the previous Congresses, which also did not make it into a law. In the 15th Congress, former Senate President Manny Villar filed a bill called the Pandemic Preparedness Act, which sought to establish a pandemic emergency council to handle the avian influenza threat and other influenza pandemics. Meanwhile, an Emergency Health Powers Act was filed in the lower house in the 14th Congress, seeking to establish a public health emergency council that will craft an emergency plan to detect and prevent the spread of infectious diseases and other public health emergencies resulting to biological, chemical, or nuclear attack. Harleen Delgado, UNTV News and Rescue, Quezon City. We serve the people, we give glory to God.
Are you tired of just typing on your gadget or just playing mobile games? Now that you must stay home to play your part in the COVID-19 battle, why not find out if there's a musician in you? In the Philippines, several instrumentalists share their talent on social media to show they are doing something productive while staying at home. Nina Almilio has the story.
Are you bored now that you are confined within the four walls of your house as you do your best to stay home and stay safe? If you are a musician or an aspiring one, make hay while the sun shines. Relish the joy that music brings in your life. Just like music producer, arranger, and musical director Jun Tamayo, who entertained netizens with his Satch Boogie cover. Lead guitarist Rod Mijares, on the other hand, turned to his electric guitar and savored a 60s feel with Apache and Blue Star by the Shadows. UP College of Music major in composition graduate Norman Bong Rueda thought, why not entertain his online friends with Que Sera Sera, played through his piano accordion. Jason Abram Cabato on piano and Evangeline Sangbaan on violin took pleasure in the OST of now trending Korean series Crash Landing on You. In Canada, Filipino couple Ryan and May Kitane sang their lungs out to the tune of Nothing's Gonna Stop Us Now, which is also their message to couples who are medical frontliners in the fight against COVID-19.
And we can build this dream together, standing strong forever. Nothing's gonna stop us now.
Another pair, Jason and Jennifer Kitane, instrumentalized one of Kuya Daniel Rason's song compositions, Pangarap ng Puso, while in home quarantine. friend Nonong Esmeria, a violinist, played a heartfelt praise song entitled Dakilang Pagtawag. Perhaps there's a musician yet to be discovered in you. Find it and hone it. Sing or play a tune of praise music to uplift your and your friend's spirit amid this health crisis the world is facing. Nina Emilio, UNTV News and Rescue. We serve the people, we give glory to God.
Experts differ in views if weather contributes to or affects the rise and fall of the number of COVID-19 cases. Now that the dry season in the country commences, can we expect the curve of the disease to flatten? Ray Pelayo reports.
Countries all over the world experience different weathers at the same time. Scientists continue to study how the cold and hot weather conditions impact the transmission of diseases or viruses that affect humans and animals. On the one hand, flu usually affects humans during the cold season. Measles, on the other hand, spreads widely during summer or the dry season. The world now awaits the findings from studies on the effect of the hot weather on the spread of the new coronavirus. In a study by the University of Maryland, researchers have observed that the COVID-19 hotspots are in areas of the globe with lower temperature since the outbreak started before the 2019 ended. Filing of cases was recorded first in Wuhan City, China, South Korea, Japan, and Iran, but now numbers are rocketing in Italy and the northern part of America like in New York. Those areas experience average temperatures between 5 and 11 degrees Celsius. But Professor Walter Ian Lipkin of the Columbia University says that hot weather slowed down COVID-19 transmission. Lipkin is a John Snow Professor of Epidemiology consulted by China during the peak of the COVID-19 outbreak in Chinese cities and provinces. In an interview with CGTN, Lipkin compared COVID-19 to influenza, which is also a respiratory disease. He said that when temperature goes up and humidity goes up, droplets, which are normally passed from person to person or from animal to person, can get heavier and they travel less efficiently. Lipkin added that virus breaks down when exposed to sunlight because of UV light. But he also emphasized that measures like social distancing and the use of face masks should be continued. The World Health Organization, meanwhile, has clarified that virus inside the body cannot be killed even by taking a bath using hot water. Hand washing remains as the best measure to avoid getting infected with the COVID-19 virus. Ray Pelayo, UNTV, News and Rescue. We serve the people, we give glory to God.
And for the news abroad, here's Kath Dumaraos live from Bangkok, Thailand. Kath, good evening.
Good evening, Diego. A painting by Vincent van Gogh was stolen overnight from a Dutch museum closed for the COVID-19 pandemic. Meanwhile, Ecuador struggles to collect the dead as coronavirus spreads in the country. This report will tell us why.
In Ecuador, Ecuadorian authorities said on Monday they would improve the collection of corpses as delays related to the rapid spread of the new coronavirus has left families keeping their loved ones' bodies in their homes for days in some cases. Residents of Guayaquil, Ecuador's largest city, have complained they have no way to dispose of relatives' remains due to strict quarantine and curfew measures designed to prevent spread of the disease. Last week, authorities said they had removed 100 corpses from homes in Guayaquil. But delays in collecting bodies in the Andean country, which has reported 1,966 cases of the virus and 62 deaths, were evident midday on Monday in Guayaquil, where a man's dead body lay wrapped in plastic inside his home for over 4 days, according to his family. Family members said they believed the man was infected with coronavirus. The body is in his home where 5 children and 7 adults live. In the USA, the pastor of a Florida megachurch was arrested on Monday for continuing to hold large church services despite a social distancing order designed to slow the spread of coronavirus. According to police, Rodney Howard Brown, pastor of River Tampa Bay Church, held 2 church services on Sunday that drew crowds in the hundreds.
His reckless disregard for human life put hundreds of people in his congregation at risk and thousands of residents who may interact with them this week in danger.
Florida Governor Ron DeSantis had issued an order limiting faith gatherings to fewer than 10 people. In the Netherlands, thieves stole a painting by Dutch master Vincent van Gogh overnight from the Netherlands Singer-Laden Museum, currently closed to the public because of the coronavirus, police said on Monday. The painting Lentetuin, or Spring Garden, which depicts the garden of the rectory at Nuenen and dates to 1884, had been on loan from the Groninger Museum in the Netherlands. Investigators were searching for security footage and witnesses and examining forensic evidence. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, European researchers have transformed low-cost snorkel masks available at local sporting goods shops into high-grade protection for medical workers and others against the coronavirus outbreak that has stretched healthcare resources. Stephanie C. details this report.
Researchers in Europe have been converting low-cost snorkel masks into respirators to treat patients or protection for medical workers battling to contain the coronavirus outbreak that has stretched healthcare resources. To help healthcare workers, a team from the Czech Technical University, or CVUT, worked with volunteers to add military-grade filters to snorkel masks, which are meant for holiday swimming and typically sell for around 600 crowns or $24 in local stores. The researchers said that tests had showed the retrofitted masks surpassed the protection of masks carrying FFP3, considered one of the highest-grade filters.
We are distributing to hospitals in Prague and in other places. We have made 2,200 pieces so far, and this week we plan 10,000 more.
A Belgian hospital, meanwhile, is testing snorkeling masks as respirators for patients, drawing on an initiative developed in Italy. The Erasmus Hospital in Brussels began working with a local medical device company to develop the masks known as Easy Breath and which cover the entire face. The Czech Republic has reported 2,878 confirmed cases of the COVID-19 disease as of 12:30 GMT on Monday, among 43,498 people tested. 17 have died in connection with the virus. Belgium has reported 11,899 confirmed cases and 513 deaths. Stephanie C., UNTV News and Rescue. We serve the people, we give glory to God.
And those are the stories from around the globe. Back to you, Diego.
Reporting live from Bangkok, Thailand.
Story of a frontliner nurse at the Philippine General Hospital who handles patients under investigation. Jill Banyares shares her weapons in a battle to fight the COVID-19 pandemic in our country. Let's watch this.
It is without a doubt that COVID-19 frontliners have been braving the threat of the deadly coronavirus disease. Here's a story as told by one gallant medical frontliner.
Sa first 4 hours, okay pa, kaya pa. Pero dun sa next half ng shift mo, pakiramdam mo, hihimatayin ka na. Ganun po siya kahirap.
Nurse Jill is assigned in Philippine General Hospital, which now operates as a referral hospital for COVID-19 patients. Her task is to monitor and manage patients under investigation, or persons who had been exposed to COVID positives and now experience symptoms for the disease.
Kami po ang nagpupunas ng tayo-tihi nila, nagpapakain sa kanila, nagbubuhat sa kanila.
As they pursue the battle, their only weapons are their personal protective gear and fervent prayers for God's mercy.
Wala pong labasan yun, walang kain, walang inom, walang hubaran ng PPE. Kasi po, nagtitipid kami ng PPEs dahil hindi namin alam kung hanggang kailan itatagal tong krisis na to. So, dagdag po dun sa hirap noon, yung pag-monitor, pagbili ng meds.
Now that their lives revolve only within the confines of the hospital, with the patients they serve, they have been isolated from the goings-on outside.
And wala kaming communication sa labas, radyo-radyo lang. So parang nakakasira po ng bait talaga, honestly, sa loob.
Nurse Jill says they must stay strong, no matter what, for the patients and for themselves as well. The new coronavirus has spread in 178 countries and regions. The enemy is invisible to the naked eye, but the world can see how strong it is, how terribly it can afflict hundreds of thousands of people. That is why governments and frontliners continue to tell people, stay safe, stay home.
Please, you could help us big time kung mananatili na lang po kayo sa inyong tahanan. Mami-minimize po yung spread ng virus na ito at sa ganun, tutulungan niyo kaming mabawasan mga aalagaan at aalagaan pa po.
The coronavirus pandemic might expand its reach further, but to stop this, every single one of us must play our part in the battle. Most importantly, remember that God's love is just a prayer away.
Amid the tens of thousands of death cases due to COVID-19, the world has seen more than 100,000 recoveries. Some of them bravely share their battles and success stories on social media. Nina Armilio reports.
There are now more than 170,000 recoveries from COVID-19 to date, according to figures from Johns Hopkins University Center for Systems Science and Engineering. In the Philippines, more than 40 have been discharged from the hospital for recovering from the viral disease. One of them is a patient managed by UniHealth Southwoods Hospital and Medical Center in Binyan City, Laguna. She is the first COVID-19 positive patient in the city. The healthcare workers in UniHealth could not help but clap for joy as the patient has recovered from the deadly respiratory disease after 2 negative test results came out. The medical professional sent off the woman, who can now go home and continue to heal. Another recovery in the Philippines is neurology practitioner Rogelio Bueno Jr. According to him, he is patient 358. In his March 29 Facebook post, he shared he has already tested negative for coronavirus. He thanks his wife, Joanna, for not leaving his side through days and nights of pain and fighting. Now, he is a proud survivor as he continues to heal. Another recovery, with Twitter handle Rich is also here, shares his victorious fight against the disease. If you visit the COVID-19 map, he is now among the green numbers. He shares that he tested positive on March 6, but after 2 clean tests, he is now a proud survivor. He thanks everyone who have rooted for him to recover, all those who sent out words of love and encouragement during the worst nights, he says. Rich is also here, says he promises to answer questions and give advice on the disease to those who need it. For them and for patients still fighting with all their might, with the efforts of frontliners, let us continue to pray and believe we can heal as one. Nina Armilio, UNTV, News and Rescue. We serve the people, we give glory to God.
Our kasangbahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the deadly virus. We are calling on everyone to be calm.
And most importantly, let us join together in prayer for our country and for the whole world to survive this crisis. You may join us in our daily UNTV community prayer at these hours as flashed on your screens. And those are the reasons behind the news. I am Victor Posare. We serve the people. We give glory to God.
And I am Angelo Castro III. Because we need to know, we will always ask why. Good evening.